Hello, everyone. Today, I'm here to share with you incredible stories of young women whose resilience, passion, and intelligence have made a mark in communities across Pakistan. My story starts from my mother. My mother is a housewife, and by the age of 11, my father passed away. It was never easy for my mother, being a single mother, to raise 4 of my siblings and myself. She couldn't complete her education, but with the passage of time and support of my grandfather, we all powered through. All of my sisters and I have been the first ones to go to university. And during my professional career, I saw that during the conferences, workshops, I was the only woman among the sea of men. And I knew this had to change. And I have to do something about it. So I started working on programs that focused on young people, such as you, majority of you, and as adolescents. So we started off by giving life skills-based education to young girls, which focused on communication, leadership, self-awareness. But we were not progressing, and we knew we had to do something about it. So we thought to create an approach where we will turn these potential victims into change makers. And we called it Kiran Approach. In this approach, each girl had to go into 20 households, taking away a message of right to an education and girls' right. Once getting those skills, these girls reached out to numerous communities, numerous households. So let me share a story of a young girl. Let us call her Ayman. Ayman was a student of class 8 when she joined the program. And she was the only woman to go this far in education in her family. And she had secretly harbored a dream to become a doctor. In her family, girls used to be wed when they hit puberty. School was very far, and transportation was expensive. And these all challenges made Ayman to think that this dream might not come true. So when she came into this program, she learned negotiation skills and her right to education. So she spoke to her teacher that she needed a little help from her, and she wanted to convince her parents to let her go and get her dream. Initially, it was not easy convincing parents in that background, in a conservative setting, and lack of resources. But eventually, her parents agreed. She is now a student of medical college, which is far away from her village. She lives by her own self, and her parents are supporting us. So this is the power of a young girl. So that program eventually moved to other cities, other schools, and almost 1,000 students were trained on this program, who eventually helped 300 other girls to get the opportunity to grow, get education, and get married at the legal age. We went off and took another ride, took another challenge, and that was to fight against tuberculosis. Tuberculosis is an airborne disease. It's highly stigmatized for young girls. Parents in those communities and where their girls are suffering from tuberculosis, they hide it. And the major fact is due to their marriageability. And that is the reason this disease is spread within the family. Our TB program teams were having a challenge, a serious challenge, to how to get an access to test and treat young women. They were having a crisis of how to mobilize young girls and reach to those vulnerable communities. In context of Pakistan, women are often dependent on men to take them or to visit to the hospital or clinics. And the reason primarily is that men don't have time. And why is that so? In those communities, most often families live $1 a day. And if they skip that day for work, eventually they would not have food at the end of the day. So we thought, why not enable these vulnerable communities and choose young women who are going to be potentially affected by tuberculosis to become change makers, to become community leaders. So we started off this approach, and where we worked with schools, public schools, predominantly those in those communities which we call hotspots. A hotspot is an area where TB is often prevalent and where patients are often coming. So we target those hotspots, and working with public schools requires partnership and working relationship with Department of Education. So we started off from Sindh, and in those schools chosen from TB hotspots, we started off a new strategy, a Cascade Model. In a Cascade Model, what we did actually was, we worked with the education department. We trained the teachers who are going to train students of secondary school, 8th, 9th, and 10th class. And these girls are going to take message to their communities. So this was a Cascade Model. But what should be the content? So we prepared a content which was called Adolescent Health and Leadership Program. It had leadership, women leadership. It had communication tools, self-awareness, health, community mobilization, and plan and act. So for the first step is to train the teachers. And when we train teachers, we train them on Adolescent Health and Leadership course initially, facilitation skills, and primarily information on tuberculosis. When I used to go into the training and share information about TB symptoms, about infection control, about treatment, testing, etc., I used to be called Dr. Ayesha. I was really privileged to know that I'm a doctor. But that was something really interesting to listen to, because we listen to those people who have information. So once those teachers get those skills, they eventually teach to their students. Now here I can show you, these are the secondary school students who were taught Adolescent Health and Leadership Program. So once they are taught, each girl has a responsibility to reach 20 households. 10 to her right side, 10 to her right side, and initially starting by her home. And the task was very simple and very different. That was TB, tuberculosis, verbal screening. And how can TB be verbally screened? Well, there's 3 sets of questions that you can ask, and eventually you can ask someone sitting next to you that, do you have 2 weeks productive cough? Somebody in your family or someone you know? So in either case, if you say yes, you might need to get tested. So in this way, these girls ask these questions to one household, one house, to another, and another. Shortlisting those people with symptoms, sharing those information to her teachers, and also, when they went into the community, they also faced challenges. And what sort of challenges they were facing? How would they go into the community? These were parents, these were community people who felt that it's difficult for them. They will roam around in the community. What will the community people say about them? This is not their job. This is not their responsibility. Is that age appropriate? When these all questions were around us, we put them away and we said we are going to move forward. And let's do this. We have done in the case of child marriages. Let's test it here. So, here comes another story. And let us call that adolescent health leader Amna. And she was named Kiran Sitara after going through Adolescent Health and Leadership Program course. And what happened was that she went into her community. She was a very bright, vibrant student. And when she went into her community, she had mixed responses. Those were very good families who welcomed her, and there were a few other families who just slammed the door. We're not going to speak to you. TBs, we are not going to speak about TB. In our house, TB? No. There's no TB. So those were her experiences of community mobilization. But in one of the households, she found that there were 2 women exhibiting the symptoms of TB. But she couldn't speak to them in detail. So she went to that household almost 3 times. And finally, she spoke to those women and asked that I'm here for this XYZ purpose. And she asked those 3 questions and spoke to them that you need to get tested. But those women said that men in our family don't have time to take us to the center. It's too far. We can't go. Who's going to pay? Another question. So Amna went back to her school and said to her teacher that there are a lot of problems and these women can't go to the facility. I have an idea. We can call the TB team to bring their services and let's have a community health camp within our school. It is nearby, women can come, and it is a women's space. And due to Amna's leadership, we got the idea of a low-cost, effective, female-space community camps. And can you imagine the turnout at the camp, initial camp where Amna and her teachers and her fellow students administered and managed? 75% were women. Where in other cases, that was totally opposite. Women don't come. There were very interesting stories. There were women from the community who had left food on the stove, half-cooked, but came to the camp because they wanted to get tested, because they wanted to get access to free-of-cost services. So that camp went a very success. We have reached out to and trained, firstly, 1,500 teachers and trained 32,000 Kiran Sitaras across Pakistan. That includes Karachi, that includes Hyderabad, that includes Sakkar, that includes Lahore, and interestingly, that includes Peshawar. And you cannot imagine what a wonderful, amazing work that those girls have done in such a difficult. Having a doubt on these girls and thinking that these are liability, not a resource, they have proven us really wrong, especially those who think that way. They had done wonders. There were few girls who have gone to 100 households. And we said to them, please, it's just 20 households. They were, no, we want to go. We want to find people who are ill. This is the passion. So in many cases, people ask us, why girls, why not boys? Are girls more smarter than boys? What do you guys think? Yes? Well, I keep that poll up as open. But why we focused on girls was mainly because girls are uniquely placed within the communities and societies. They can easily go into the household. speak to women, and discuss. However, in case of boys, it can't be possible in the cultural context that we live. But also to tell you that when we build such movements and we bring such vulnerable groups together, eventually state also comes in and also become part of your movement. As in case of Sindh, the Chief Minister, he also appreciated and endorsed the Kiran Sitara program and the power of these girls at a gathering of 10,000 girls in PF Museum. And you cannot imagine, we were really worried that the traffic is going to choke. The whole Karachi is going to choke because of us. But it went amazing. Similarly, in the case of Khyber Pakhtunkhwa, Chief Minister also lauded the support, and he also admired the efforts of these girls. These young girls are powerhouses. They're dreamers. They want to do something big in their life. Let's give them a chance. Let's give them an opportunity. And together, here we promise to do whatever in our capacity we can so that these girls can move forward. They're going to become mothers. They're going to run a family. They're going to be somewhere really big. So we need to give a boost to them and a belief in them. While working in different cities across Pakistan, we aim to make every secondary school girl Kiran Sitara. And we also want to reach and aim and plan, hopefully, inshallah, 1 million Kiran Sitaras in the coming 3 years. We also felt that when we work with girls, there are many other challenging needs. There are many other aspects or themes that are unaddressed, such as other health needs, child protection, career counseling. So these things are very important for us to take forward. Well, what they say, it is true. Never underestimate the power of a woman. सितारों से जहां आगे और भी हैं. Thank you.